And if you believe with me, rise on your feet and let's sing together. Yo, 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 yo.
Good morning. Good morning, good afternoon, good evening to all the participants. I would like to welcome you all to Africa Cafe of the PATA Summit 2023. The morning premier session has been an excellent start to the summit.
A sessão da
Today,
manhã foi
the
uma
focus is
boa
on
iniciativa.
face of
Esta
care,
manhã
health providers,
falou
and
sobre a questão dos
communities
cuidados, os provedores de saúde e comunidades.
at the front line of the pediatric and adolescent HIV
Na
service
linha da
delivery in
frente
Africa.
de pediátricos,
And so, in this Africa Cafe, we are going to be looking at how can we build a stronger
vamos
team
ver como é que podemos
of health
criar
providers and
uma
communities in the
maior e
front
mais
line.
forte equipa.
In this Africa Cafe, we'll be sharing experience on how to build stronger teams of health providers, as having stronger health providers team in critical in order to provide the necessary care and support to all clients' needs and hence improve client health outcome. As we heard in the prime session from Luan, who spoke to the face of care research done last year at the summit, teamwork and strong teams was identified by health providers as an important priority area to make them feel empowered and supported to provide pediatric adolescent HIV and SRHR service. I will reduce my speed so that the translate can follow up. So this Africa Cafe will look at the different ways that we can build stronger team. We will have 3 presentations, which will be provided, provide practical ways in which we can build stronger teams. This session, therefore, aims to help participants to first understand the value of building stronger teams, build strong adolescent-friendly teams. Third, better integrate lay cadre of health providers such as community health workers and peer supporters into their teams. And last one, work toward having stronger relationships between clients and clinic and community. So before we start with the presentations, in terms of the format of the session, we will have 3 presentations followed by Q&A session. While the presentation are taking place, please, can participant use the Q&A box at the bottom of the screen to type the question or comment. Please remember to indicate which of the presenter the question is for. Some questions will be addressed and or responded in the Q&A box, with the presenter writing the answer or reply, while the other question will be highlighted to the discussion at the end of the session. So now moving on to our first presenter. Our first presenter is Sister Neda Musonda. Sister Neda is a dedicated adolescent focal point person at the Charleston Subdistrict at the Ministry of Health in Zambia. She is a highly experienced nurse, epidemiologist, with over a decade of service as a registered nurse. Holding a bachelor in nursing with a major in community health, she's very good at planning, coordinating, and providing essential service in HIV and AIDS and SRHR and SGBV for adolescent and young people in Charleston Subdistrict. Her commitment to promoting the well-being of adolescent and young people is truly commendable. Sister Neda will be presenting on how to create and foster adolescent-friendly teams. So welcome, Sister Neda. Over to you.
Hi, everyone. Hello, Teles. I'm very excited to be part of the 2023 summit, and I'm looking forward to meaningful discussions. Thank you. Hello, once again. So this year's summit in this cafe, we're looking at building strong teams on the front line of service delivery. What will it take? In that line, I'll be sharing a presentation with you on how to create and foster adolescent-friendly teams. So you will agree with me that teams accomplish goals that individuals cannot, and working as a team is very workable and achievable if together as a multidisciplinary team, the health care workers together with partners, the communities, the peer supporters, and other organizations, we are able to do it. A healthy care team that is passionate, available, and fulfilled in a healthy work environment is likely to give comprehensive and good health services to their adolescent clients. Next slide, please. So how do we create these adolescent-friendly teams? So it will circle around asking, what do the young people want? Who should create these friendly teams or the spaces? Where should adolescent-friendly spaces be created, and what is needed for these spaces? So if we ask what young people want, every adolescent and young person that comes through our facilities feel good and want to be heard. They want someone who will know their needs and understand them. They want someone who will be able to listen to them and provide feedback. And this can be used and integrated into our quality improvement so that service providers can meet their adolescent needs. So who should create these adolescent-friendly teams? Everyone has a role to play in creating the adolescent-friendly teams. The healthcare workers, let's talk about the community health workers, the peer supporters, support staff in the facility, security by the gate of the facility. They all need to play a role so that we can create adolescent-friendly teams in our work facilities. Creating these teams makes young people feel comfortable even when they walk into a facility. Just the way they are greeted by the security worker by the gate, they feel welcomed even to access services within the facility. So where should these spaces be and what is needed? So the entire health facility should be adolescent friendly. Regardless of it being friendly like that, there should be some designated space where the young people can go and sit, express themselves with privacy, with healthcare workers who express confidentiality, as well as a space that will offer them resources and as well as commodities for their care. Various countries have got strategic guidelines that support adolescent and young people with their friendly spaces and what should be there. So all that should be incorporated into. Thank you. Next slide. In creating the adolescent-friendly teams, the healthcare system needs to understand that we are a multidisciplinary team. There's an example of a human body. What the hand can do, the leg might not be able to do. If the leg says, I will not go to where you want me to go, the body will not move. So together, each body part playing a different function, they work together as one. So even in the healthcare team, in creating these adolescent-friendly teams, we should be able to recognize each other. Let's recognize their strengths and the roles that each one of us plays. We should be able to coordinate and work together, providing holistic care to our adolescent clients, as well as engaging the caregivers and recognizing them as part of our teams for better health outcomes. From the health facility, there's to an extent where we provide care, but there's that continued care at home. So the caregivers need to be engaged for continuity of care and be recognized as part of the multidisciplinary team. Next slide, please. In creating our teams that are adolescent friendly, we need to enhance our communication as well as having available commodities to use. And in having effective communication, we are talking about assertive and healthy communication, meaning we need not have behind talks. If we're working in a team and we are trying to create this adolescent-friendly environment for our young people to enjoy, I should be able to coordinate with the person from the laboratory services, a person from the counseling department, a person from the mental health department. And if there's any gap in our care, I should be able to approach the person, we talk about it, and not going through the third person in our healthcare team. We should also be able to provide constructive feedback to each other. Where your colleague has done well, be able to upload them and encourage them. We also need to show consent for each other as a team. Apart from communication, we also need to have available commodities. What are we looking at when we come to commodities? We need to have availability of all contraceptive methods. We need to have available drugs. We need to have available IEC materials for our skills building and development. Next slide, please. So, what is being done for frontline health providers in creating adolescent-friendly teams? So, creating these adolescent-friendly teams needs a system, a workable system. It is very achievable, and almost every one of us are practicing it and doing it without maybe even knowing that we are doing it. So within the facility, it's very important to have constant orientations for all members of staff. And all members of staff, I'm talking about the healthcare providers, the support team, the security. Everyone needs to have frequent orientations about adolescent health. Everybody needs to understand who an adolescent is, what is special about them, and what they need to get. Within the facility, data review meetings are also very important for the multidisciplinary team. because it is through data that we are able to identify and reveal gaps in our healthcare system. And with good communication within our team, we are able to plan and chart the way forward and address the gaps so that we can be able to close them and serve our adolescents and young people better. Experience sharing is another thing that is needed to be done in facilities so that we build strong adolescent-friendly teams. Experience could be the first encounter you had with an adolescent, or where you once maybe handled an adolescent in a way which you thought, okay, here I've really done my job, and the adolescent gives you feedback. I'll give a practical example of myself. One of my mentors used to always say, when I just started looking after the young people, one of my mentors would always say, did you know that a headache for a young person can be in the pants? And I used to think that was a joke. But then after starting to interact more and embed myself into working with adolescents and young people, I realized that an adolescent can come through presenting with a headache, but it's not actually the headache. They come with many other things that they would want to share with you. Sometimes it's just a word of encouragement, or maybe they want to ask something that they just want to hear from a reliable person. So experience sharing within the healthcare team helps each and every one of us in the multidisciplinary team to realize and think beyond the box when you see a young person. Next slide, please. So after we have created these spaces for the young people, and then we have built that team, the health providers are working as a multidisciplinary team, they are communicating, they have their commodities available. What is needed to be done for the frontline providers? What do we need to do for this healthcare worker to make sure that the healthcare provider provides a quality service? So healthcare workers need a little time away from their routine work. They need to recreate, they need to engage and interact with peers, and these peers could be colleagues, also the young people themselves, the adolescents, the peer educators, the peer supporters. Like, they need to mingle outside working hours. They need to team build. They also need orientations and to develop skills so that they feel equipped and ready to handle what comes before them. Developing skills and orientations also gives someone confidence to be able to face any challenges, or to be able to face new situations that may come your way. Next slide, please. The frontline health providers also need to feel appreciated. Appreciation could be formal or informal. Sometimes appreciation could just be a sincere greeting from your supervisor or from someone from a different department, like greeting you, how are you, meaning it, like asking you, how are you really doing? Or someone just patting you on the back and telling you, you did well, Neda. It could be even a corridor appraisal, like maybe your supervisor saw you interacting with a young person, and then they just tell you, I like that you gave time to that young person, even along the corridors of the facility. Keep it up. All that occurs as appreciation to the healthcare worker. So the frontline health provider also needs time to practice self-care. Before you care for another person, it's always good to be in a good health state yourself. So as a frontline health provider, you need to normalize looking after yourself. You have to eat well, have enough sleep, exercise, do things that you like to be happy. You also need to be mentally aware about yourself. Know when you also need to seek help. Know when you feel stressed, when you feel you need someone to talk to, when you feel you need a hug. You should be mentally aware about yourself. Next slide. So now, after we have looked about the teams that we have created, these teams are working together, the healthcare workers are looking after themselves, and then everything, like they're able to provide good services to the young people. To summarize what I've just been trying to say, a strong adolescent-friendly team will equal a strong system. And when we have strong systems, we'll be able to listen and learn from our communities and the needs of the adolescents and young people. Adolescents need a space where they can access care. So we need adequate space for working, which will have enough commodities and everything that we need. To make sure that we create strong teams, we'll need our multidisciplinary efforts from the entire team so that we are able to build strong adolescent-friendly teams working towards one goal. Motivation of healthcare workers is something that needs to be done on a constant basis, as it is key to good performance and excellent service delivery, which helps to sustain programming. And motivation for healthcare workers could be in lines of skills enhancement, skills building, so that people feel more comfortable, more confident to be able to provide the services. It could be sending a staff for a conference, sending a healthcare provider for a summit, giving them a day off. It could be an award of appreciation, which can be done in an environment of the health facility. Could be during a meeting. You raise one healthcare worker and just thank them for the work that they've been doing. Like, you show that this healthcare worker is doing a good job and they are hardworking. All that are part of motivation practices. And the last motivation I'll talk about is the issue of helping someone with transport refunds. Like, healthcare workers sometimes go out of their way to make sure that they reach these young people. You could also remunerate them with some little appreciation. With that shared, I hope that I've been helpful and that various teams have learned how to hold teams together so that we create strong adolescent-friendly teams. Thank you so much. Over to you, Teles.
Thank you. Thank you very much, Sister Neda, for sharing your practical experience on how to create strong adolescent-friendly health teams. In your presentation, you mentioned the steps on how to create adolescent-friendly teams. I like the body part example. Definitely, we need to involve everyone in order to improve our health care service in the health facility. Before we move to the next presentation, a reminder to participants to please type in your questions in the Q&A box and general comments. And please indicate your name and country when asking a question, and also to who you are asking the question. And for our presenter, please remember that we have live translation, so please don't speak too fast. Sister Neda, you did slow down, so thank you for that. We appreciate. Our second presenter is Dr. Happy Betty Powell. Dr. Happy Betty is a medical doctor with over 7 years experience working in HIV and TB programs from subnational to national level, offering technical assistance to frontline healthcare providers, implementing partners, and to the Ministry of Health of Uganda. She has, in the last 3 years, worked in community health worker to improve outcomes among children and adolescents living with HIV. Dr. Happy is a senior technical advisor, care and treatment at ECPAF. He will be presenting on how to leverage community health workers and peer support to improve outcome of HIV programs. Dr. Happy, welcome, and please proceed with your presentation.
Thank you so much for having me at the PATA 2023 Summit. My name is Dr. Happy Betty. and I work for the Elizabeth Glazer Pediatric AIDS Foundation in Uganda as a senior technical advisor for care and treatment. And in the last few years of my work, I have worked with young people and communities at facility and community level. And today I'll be speaking to us on leveraging community health workers and peer supporters to improve outcomes in HIV programs. By WHO, a community health worker should be a member of the community, selected by the community and accountable to the community for their activities. They are supported by the health system, though they don't have to be part of the organization of that system. However, they should have received some form of shorter training than professional workers. And when we speak about peer support and peer supporters, a peer is a person of the same age or gender, health status, background, geographic location, or ability as another specified person. And peer support, we simply refer to practical, social, or emotional support between people in a community of interest. Peer supporters should be trained to provide peer-to-peer psychosocial support and have a range of skills that enables them to respond to the different health-related situations that their colleagues face. Some of the key roles of community health workers and peer supporters at community level include participation in peer-to-peer support groups where they share in-person experiences. This can be one-on-one. They actually can engage in offering directly support observed therapy, linkages within the community, from the community to the facility, offering adherence counseling, disclosure support, provision of SRHR education and services, and documenting and reporting what they do in the community. At the facility, as health providers, we need to support the community health workers and peer supporters to participate in clinic preparations through which they are able to identify the services that their clients need. They can also participate in peer-to-peer support groups at the facility, conduct linkages within the facility, between facilities, and from the facility to the community. We should also be able to support them to share their experiences at the facility level when the clients come for care, offer disclosure support. They should participate in facility progress and feedback meetings in order to pick feedback and updates and participate actively in case management. And with all these roles and activities, they should be able to document and report what they have done. I will now speak to us. What are some of the facilitators of effective and sustainable integration of community health workers and peer supporters into the healthcare system? Some of the facilitators include financial and non-financial incentives. And as health providers, our role is to ensure that there is timely payment of their stipends and transport refunds, and lobby for in-kind items that facilitate their work. Some of these include, but are not limited to, raincoats, bags, bicycles, gumboots, internet data and airtime packages, and cell phones. All of these items facilitate the work that they do. As health providers, we must ensure well-organized service delivery at the facility level. And how do we do this? By promoting their participation in generation of work plans, whether on a weekly basis, monthly basis, or quarterly basis. As they generate these work plans, they are able to attach meaning and responsibility to what they do. We should provide them lists of contacts in the community and facility for them to easily link recipients of care for different services. We also need to ensure collaboration and engagement with communities. And how do we do this as health providers? Through routine facility community meetings, from which we obtain feedback about the myths, the perceptions, and the needs in the community, which inform our services to the clients. However, we also use this platform to provide the community health workers and the community with updates from the facility. Yes. We also have to ensure supervision and accountability is happening. Clearly written and explained job descriptions need to be provided to the community health workers and peer supporters. And we need to always conduct regular performance check-ins. This helps us to review their progress and obtain feedback from them. Critical to this is the fact that community health workers also need care. Peer supporters need to be cared for, and we need to routinely offer this support. The other facilitators include ongoing capacity building. There is need to schedule regular capacity building sessions based on identified capacity needs, provide relevant IEC materials for them to read, update themselves, and provide appropriate care to the clients, and where necessary, translate these materials to the local languages. We also need to plan manageable workloads, and this includes ensuring that task shifting is appropriately managed, supporting them to plan their daily work to maintain a good quality of care. Yes, as health providers, we also need to ensure adequate supplies and commodities, ensure that there is stable stock of testing kits, rapid testing kits, HIV self-testing kits, family planning commodities, data collection and reporting tools to enable them to do their work successfully. In regard to policy, it's our role as health providers to support them understand policy through on-job mentorships, continuous professional development, so that they are able to implement the right guidance for us to reap the results from their work. What is the value addition of this integration? When we integrate community health workers and peer supporters, what do we benefit? There is improved facility community collaboration. Community health workers and peer supporters serve to provide rolling feedback from the community. And this helps us, as they participate in case management, helps us to identify and respond to gaps and barriers to treatment in real time. The other value addition is promotion of client-centered care, because this is the hallmark of meeting client needs. This cadre provides the avenue for us to tailor our care to these needs. And in addition to that, this integration promotes client-led service delivery. As we promote client-led service delivery through this critical link of community health workers, there is reduction in health disparities as they take the services closer to the recipients of care. Improved quality of care. Routine feedback from the recipients of care informs our improvements at the facility level in the services delivered to the community. And lastly, this integration promotes client satisfaction. Community health workers and peer supporters directly meet the needs of the client at the service delivery point, hence improve client satisfaction. Thank you so much.
Thank you very much for your presentation, Dr. Happy. In your presentation, you remembered us that the peer supporter are now and should not be left alone in their health facilities. Health providers are in an important pillar for their inclusion and support. Health providers should not be left behind when a peer supporter is integrated in the healthcare service. Thank you. Moving on to our final presentation. Our third presenter, Margaret Mbugua. Margaret is a proficient social specialist with expertise in economics and sociology, with over a decade of experience in policy and advocacy in health programming sector. In her current role as a technical advisor at PATA in Kenya, she provides technical support in HIV and sexual reproductive health and rights, with a focus on various essential areas, including universal health care, financial, ART adherence, community monitoring, and so much more. Margaret will be presenting on how to success any project is reliant on a quality of the relationship within different levels of the ecological model. Over to you, Margaret. Thank you.
Thank you, Dr. Teles, and good afternoon, everyone. My name is Margaret Mbugua. I work as a technical advisor at Pediatric Adolescent Treatment Africa. I'm based in Kenya. So I'll move straight to my presentation that looks at the ecological model and looks at the various relationships and how do we build those relationships and what works and how can we enhance those relationships. Thank you. First, I would like us to look at what it means. Yes, sorry. First, I'd like us to look at what it means in building relationships. I appreciate my two presenters, Sister Neda and Dr. Happy. They've been able to bring out some of the relationships and how we can enhance adolescent-friendly services within our spaces and how it contributes to better health outcomes. So my presentation is looking at specifically the different types of relationships that are crucial for improving health outcomes for both children, adolescent, and young people, and how some of these adolescent and young people face unique challenges, and what can we do to build strong healthcare teams so that we are able to deliver comprehensive and targeted care during the critical stage of development. My other aspect is that once we have effective and capacitated healthcare teams within our health facility, Dr. Happy talked about how they can be multidisciplinary and how can we have a better communicative team and how can we have child, adolescent, and youth-friendly in order to improve service delivery, meet the needs of children, adolescent, and young people, and how central and crucial these relationships are the foundation for delivery of services within the healthcare system. So we will look at the different levels of relationships and why we are also looking at the client-centered approach as the pivotal, as the central role within this ecological model. Next slide, please. We want to introduce the ecological model that has been used within PATA programming and how these ecological models have strengthened the relationship between the health provider teams and why we say that they are the cornerstone of delivering quality health care, as they are the link between the client and the clinic, and then there's the face between the clinic and the community. So we look at the ecological model in various levels, and we know that this ecological model can be able to guide healthcare teams in delivering comprehensive healthcare and also contributing to better health outcomes. In the ecological model, we want to stress on the fact that it is heavily anchored on client-focused approach and looks at the needs, the perspectives of young people and children and takes into account those perspectives and values in terms of building those relationships. So there is a critical aspect in the community clinic interface, and because it represents the point of contact, the interactions between the the clinic and the community and the clients that they serve. So we are stressing that health providers are actually central in this role as they glue, as we tend to think that they're the glue that brings the community and the client together and enhances the role that they play in the community. And those relationships, once they are enhanced, then service delivery in terms of delivering quality care is improved within the community. Next slide, please. So I want to look at the ecological model. It has the different interfaces. So we have the adolescent and the young people and the children at the center of the ecological model. We look at their needs, we look at their values, we look at their perspective, what is it that they need, and how they play a critical role in terms of delivering client-focused approach. Then the second level, which is green, is the health providers. Providing clinical intervention, improving service delivery in terms of health services. And also, when you look at them, they're in the middle between the community and the individual AYP and children. So they are the glue. We say they are the glue that brings together the community and the individual. So their position allows them to bridge gaps, facilitate communication, and also promote holistic healthcare because they consider both individual needs and also community factors that play a role in delivering healthcare. So we believe that health providers contribute to a more integrated and client-centered approach to healthcare. So, okay. Then what we want to bring out through the ecological model is the three aspects that it focuses on client and clinic interface. That means it focuses on the client-first approach and puts the adolescent or the child at the center of the response. So we need to understand their unique needs. We need to understand their perspectives. We need to understand what kind of care that they need and how do we involve them in decision-making within the facilities and also in the community. Then the second aspect we want also to bring out very strongly in the ecological model is the clinic-community interface. So this is looking at the community engagements that we have within the community. We also want to appreciate the referral and linkages that are done by community health volunteers or health promoters. And we also need to bring out the community-led monitoring and feedback that is done so that we are able to know where are the gaps, what are the adolescent and young people saying in the community, what is it that we need to do to improve services and meet their needs. So these are the core of the ecological model that we need to look at. Then the other aspect that I don't want to leave behind is the data and research and how it's useful in enhancing some of these relationships, because through the data collection, through some of the research, we are able to understand what are the gaps in terms of improving services that we deliver to adolescent and young people. So we use some of those community monitoring or scorecards or gap analysis. Also, we use the comprehensive assessment within the health facilities. And Amirad, I know there are various tools that are used in the community and both at the clinic level that help us understand the gaps, help us to know where are we doing well, what is it that we can enhance, and what is it that we can address so that we improve service delivery gaps based on the data that we've generated. Next slide, please. Then the next slide is just looking at how do we apply the ecological model, especially to the HIV, SRH projects that we run in the community. And the principles of the ecological model are based on the foundation of the relationships. I believe it starts with the smile from a health provider when a young person walks into the health facility. That goes a long way in terms of enhancing. So sometimes when you go to the clinic, we see a lot of adolescent and young people coming to the clinic and asking for a particular clinician, a particular nurse that they are comfortable with, and leaving out the rest of the health providers. That means that adolescent or young person, they've built a relationship with this clinician or this nurse. So we would like to see that all those relationships across all health providers at community level and also with the adolescent and young people and children is enhanced so that the adolescent and young person does not come to the clinic looking for a particular doctor, a particular clinician, but is comfortable to be attended by any health provider. So it looks at the quality of relationship that has been built between a friendly health provider and the young adolescent and young people, and how the young people's choice and autonomy is respected in the service delivery, and how they access care within the health facilities. So health provider is then able to ensure that young people can also be linked to broader team within the clinic, and are able to access more comprehensive care. So next slide, please. So I would like to give just a snapshot of the youth care project that is being implemented across 3 countries, that is Kenya, Tanzania, and Zambia. The youth care project is focused on building consistent, trusted relationship between health providers and AYP. We run the client satisfaction forms and the feedback forms. So the youth care has on board 3 people that are the adolescent and young person. It has the peer supporters, it has the community health volunteers, and also it has health providers at the center of delivering self-care services. So all those relationships between the AYPs, the health providers, also working closely with the community health volunteers. So we are able to enhance those relationships and build onto those relationships. And we are also able to identify some of the gaps that that need to be addressed, so that we build stronger relationships between the teams. Then the youth care project supports health care providers to understand the concerns and needs of adolescent and young people. And we do this through running the client satisfaction forms, and also do the feedback sessions within the clinic. So the adolescent and young people are able to tell us where the gaps, where are we doing well, if it is in youth-friendly provision of youth-friendly services, how do they see the youth-friendly services that are being delivered within their healthcare facilities. So we've done this across all countries. It is an annual activity that is done, and it's done across all the 21 health facilities in Kenya, Zambia, and Tanzania. So after identifying some of these gaps at facility level, we develop the quality improvement plans that seek to address the gaps. And this is done hand in hand between all groups, the adolescent and young person, the peer supporter, and also the community health volunteer, and also the health provider. So there are myriad of activities and interventions that are done to address those gaps. And so far we've seen better uptake of self-care interventions. We've seen there are friendlier health providers. We've seen there's a positive impact in terms of perception of the health facility. And then there's more enhanced relationship within the facilities that are under the project of youth care. Thank you. Next slide, please. So lastly, we need to just run through what can we do. And I know some of these activities are done over and over within the facility, and they contribute greatly to enhancing some of those relationships. So we know that communication, meaningful engagement enhances some of these a relationship, shared decision-making. There are quite a lot of things that we can do: respect for autonomy. We look at client-centered education programs, health provider trainings, feedback mechanism, quality. I've talked about feedback mechanism, and I think also Dr. Happy stressed on this client satisfaction feedback forms and how they're important in addressing needs for adolescent and young people and ensuring that we meet those needs. So also lastly, the quality improvement plans. Next slide, please. So, and then what can we do also to enhance the relationships? I said that there is the client and clinic relationships, and also there's the clinic and community relationships that we look at. Also, we need to enhance, to point out that promoting the importance of community engagement, whether it is at the committee within the hospital boards, whether it is community monitoring through the scorecards. So there are also various activities that we can look at There's also the referral and linkages within the community, led by the community health volunteers. And also there's the community dialogues, the outreaches that we continue doing. All those are to build the relationships between the clinics and the community. And it's supposed to be something that is ongoing, because every day the needs are evolving within the community. So one aspect that we need to bring out strongly is why we need to build the relationships at those various levels, and what it means to delivering quality care and also improving service delivery. So health providers can contribute to improved health outcomes and healthier and more resilient community. So we say and we emphasize on the application of the ecological model across all projects. Thank you. I hope I've been able to cover how to build some of those relationships. Thank you. Over to you, Dr. Teles.
Thank you, Margaret. Thank you very much for sharing your experience of value of strong relationships between client, clinic, and community. Ecological model. Thanks to you for bringing the diagram slide. It pictures perfectly the ecological model. Everyone now understands this model after your presentation, for sure. So thank you so much to all of you, all of the speakers. The presentation has been most informative. We will now go into the Q&A portion of the session. So please, can I ask all the presenters to keep their answer brief and to the point and respect the time available to us. I will ask also to open your camera, because now we are going for our Q&A session. Waiting for my colleagues to open the camera. Whoa. Now we need to see you smile. So say that, first of all, when they invited me to share this session, I was very nervous. But then I realized that all the presenters are women. So now I'm relaxed. So let's go to the questions. I see that there are questions that are already answered by Dr. Epi. Thank you for that. But there is another one here. So it's Elpidius Ernest. He is from Tanzania. He is asking if are these peer-to-peer support programs effective, taking in consideration that those programs involving adolescent and young women living with HIV? This is a question to you, Sister Neda. Please, over to you.
Thank you very much, Elpidius Ernest, for that question. I would say yes to that question, because I've come to see and learn that if interactions are happening from a peer to a fellow peer, sharing experiences and their concerns, there's that freedom, and there's also that a kind of relaxation that just takes place in the peers, even as they share whatever is going on with them. So I would say yes, the support programs are very effective. Thank you.
Thank you. So we will highlight a question now to Dr. Happy. So Dr. Happy, there is a question that you did answer, but please, how best can we monitor community health workers to ensure that they are sticking to the guidelines? This is a question from Marian Mutsingudzi from AIDS Funds. Over to you, Dr. Happy.
Yeah, thank you, Dr. Teles. I want to say that successful monitoring begins with successful integration. And as we start on the process of integration, if one is beginning from the word go, we need to make sure that we design a framework, tools that are friendly to community health workers, and structures for them to report to, but also to document and report what they do. And one of the other things that I mentioned was their involvement in the work that the healthcare workers are actually doing. For example, review meetings. When we do not involve them at the facility level, it's difficult for the team, the health providers, to appreciate their contribution. And so they get left behind. So it's critical that we involve them in these meetings. It also helps them appreciate their contribution and put meaning to it. But also I want to mention that depending on your country, if there are community structures, I mentioned in the presentation that community health workers are selected by the community and accountable to the community. So it's very critical that we engage the community structures around us as health providers, around our health facilities, to help hold the community health workers accountable after designing the different work schedules and reporting tools and involving them in what we do. Over to you, Dr. Teles.
Thank you, Dr. Happy. So now we are going to, I see another question. Another question here is from Stuart Quinn. This question is for you, Margaret. He congratulates you for the presentation. And the question is, have you documented your experience with community monitoring, for example, scorecards, surveys, and are they published? As I would like to be interested to read them. Thanks. Over to you, Margaret.
Okay, at PATA, we do the scorecard as part of our projects and also to look at the needs, perceptions of adolescent and young people. So this is done on an annual basis across all projects that we implement. And part of it is that we analyze this data and have feedback sessions at facility level with the health providers, the community health volunteers, and the adolescent and young people and the peer supporters, just to try and look what are the needs of adolescent and young people, and what is it that we can do to improve the gaps that are glaring. So we do this, and we've been able to share across different platforms, also sharing at conference level. But what we've not done yet is publish some of these results and share them onto our Linking and Learning Hub. But I believe that in future, because it is a very key area if you are to deliver client-focused services, so we need also to share what is it that the adolescent and young people are saying. And also during the feedback sessions, we also get to listen to the health providers as we present some of those feedback from the adolescent and young people. So I think moving forward, this is an area we can look at and how to publish some of these results. But at country level, we share with the Ministry of Health the results, and also at the county health management team for counties that have devolved health services. Thank you.
Thank you. Thank you, Margaret, for your answer. So I will have an additional question to Sister Neda. You described what is being done for frontline health providers in creating adolescent-friendly health teams in your presentation. So now let's try to see what is being done by the beneficiaries and also the system. Over to you.
Thank you very much, Dr. Teles, for that. So to speak to that one, like for Zambia, we have the National Strategic Plan for Adolescents. And in that document, the Ministry of Health, their desire is to have each and every facility to have a youth-friendly space. And with support from partners, the ministry is really trying by all means to make sure that each facility has that space. We may not have the actual physical space, but space is being provided even from anywhere where the young people can meet. It could be even under a tree, they could meet, get their lessons and interact with each other like that. So yes, there are deliberate policies that are there to guide so that each facility can have the friendly teams. Thank you.
Thank you. So we are going to the final question. The final question is from IRHP or Mabai. Is a question to Margaret. Margaret, what are the youth programs, work-in facilities that champion youth closure in HIV response? Over to you.
Could you repeat the question again, Dr. Tellez?
Yes, he's saying, he has two questions here, so you can see which one you want to answer. So the first one is, what are the youth programs that champion youth closure? Maybe youth disclosure, youth closure in HIV response. First question. The other one is, what are the initiatives aimed at motivating healthcare givers in regarding to resource mobilization and allocation in hardship areas? Over to you.
Okay, we have various youth programs that are happening within the health facility, and I think the person meant disclosure. Disclosure is quite a challenge within the health facilities, right from challenges with the caregivers in terms of disclosure, both at home and also to relatives, and also for some of the school going, especially the boarding school, those who are going to boarding facilities and transitioning from maybe primary level to secondary level and at various spaces. So some of those challenges are there. So there are various adolescent and youth programs that are running at facility level. So in Homa Bay, we have the Youth Care Project that is running. So we look at some of those trainings for caregivers on disclosure and also having specific forums for adolescent and young people living with HIV in terms of discussing the steps in disclosure. So I would not know which particular health facility, but in Homa Bay, we work in 7 health facilities. But I know there are so many numerous programs also by EGPAF, LVCT, and other partners that are working on board across counties, different health facilities in Homa Bay. Thank you.
Thank you. Well, my ladies, thank you for being here with me. It was a pleasure to chair this session. And now, unfortunately, we need to wrap up to the end of this session. I'm going to ask Dr. Happy to give us a key message. What is the key message you want to give the participants from this session? Over to you, Dr. Happy.
Thank you, Dr. Tellez. The key message I would want to leave with us is that integration of community health workers and peer supporters is very beneficial to the healthcare system. As we work towards delivering client-centered services, there is no way we can separate ourselves from the community, and our link to the community are the community health workers. We need to carry along the structure in the community and be able to bring services closer, but also understand the need that is still out there and be able to respond as health providers. And at everyone's level, it does not matter at what level of health service delivery one is, the community is all around us. And the onus is on us to always identify opportunity for integration and delivering the relevant services to the community. Yeah, thank you so much. Over to you.
Thank you, Dr. Happy. So moving forward, Margaret, tell us, what is the key message you want to leave us with it? Thank you.
My key message is on the, how we can capacitate the frontline health providers together with the peer supporters. This is inclusive of also the community health volunteers, because they do great work within the community, and they are the linkage in terms of delivering quality healthcare and also improving service delivery. So as we look at the client's needs, we also look at gaps that are affecting peer supporters, gaps that are affecting community health volunteers, and gaps that are affecting health providers, and how can we use our projects to capacitate those three frontline health providers. Thank you.
Thank you, Margaret. I want to, before I hand over to Sister Neda, I want to ask you, because we had other questions that are left behind. Please, panelists, speakers, can you share your email so that the others, in case they have questions or request additional information, can reach out to you, please. So, Sister Neda, it seems you are the chair now. Please, can you give us your key message so that we can end this discussion? Thank you.
Thank you. Thank you very much, Tellers, for that. So a key takeaway message that I would like to bring across is an emphasis on teamwork and multidisciplinary efforts, because together we can achieve greater things than being alone. Every person, like each and every healthcare worker, apart from waiting for motivation from our supervisors and others, we should also have that inner self-motivation, which will encourage us to even be more friendly to our young people, to greet them with a smile, and together we will be able to provide comprehensive and good services for our young people, making sure that they stay healthy. Thank you. Over to you, Teles.
Thank you. With all of this key message, our session comes to an end. I want to say thank you again to my brilliant and very charming presenters. And yeah, looking forward to connect with you again in person or virtually. And also thank you, Pata Samiti, for make this happen, because we really need to exchange experience and content in this type of forum. So for the questions that are in the Q&A, our speakers will then answer all after the session. Thank you again, and continue enjoy your workshop session in your country. Goodbye.